Hi friends, welcome back to my channel. If you're new here, my name is Jamie. I am in my final year of physical therapy school and I am on track to becoming a pelvic floor physical therapist. If you're like, wow, she looks different, I did get bangs, so this is my first YouTube with my new haircut. Same girl, different hair. And I just want to take today to talk about my progress so far and tell you a little bit about where I'm at in my pelvic floor journey. I completed my level 1 and level 2 labs a couple weeks ago in Wisconsin. I traveled from Detroit to Wisconsin and it was a lot of information, but it was really great and I feel much more prepared. Okay, so before I get into the labs, I think it's important to know if I mention like the vaginal versus bowel and why are we learning these things. It's because pelvic floor is made up of muscles, and physical therapists, we do treat muscles, obviously. It's just like any other muscles. When there are dysfunctions, the muscles can react with, tightness, trigger points. There can be weakness in the muscle. So if you think about it, it's just like any other condition that a physical therapist treats, but we're more specialized in this area. So the pelvic floor supports our organs. It sits almost like a hammock. So then all of your organs, which these are not all of them, but I took some out, they would be placed in here. They work as a hammock to keep everything supported. They also work with the diaphragm to help with normal breathing. So as the diaphragm lifts, the pelvic floor lifts, and as it relaxes, everything lengthens. So works, they have a synergy together. I guess to get more into like the separation between like level 1 and level 2. Level 1 is going to be your vaginal exam. Prior to these labs, we had 2 days for level 1 of all day information, webinar. And so with the level 1, I went through the American Physical Therapy Association, the Academy of Pelvic Health. So with this, we looked first at just external examination. So if you were coming in to see me, it doesn't mean you need to do like internal right away. That's nothing that is ever going to be a need if someone doesn't feel comfortable, but it does give us a lot of information. But the first thing is looking externally and seeing, are there any issues with the tissue itself? Do we see that the tissue is thinning? Are there any adhesions? Are things moving correctly? So we have like our superficial muscles here, so we can palpate that, not going internally. And we also can see how the perineum moves, so that body between the vaginal and anal openings. And so during that examination, we might have you breathe a certain way, and seeing how a change in pressure and how with that change of pressure, how these muscles are moving and if they're contracting and relaxing properly. So there's a lot of information we can get externally. And that was like the first thing we really emphasized in the first portion of the lab. Then we spent a lot of focus as well going into the internal vaginal exam. So I do want to like preface this saying, like, those therapists that you're seeing who are pelvic floor therapists are trained in this. This isn't something that just anyone knows how to do and how to do properly. So just to put that out there, that we're all trained very intently to be able to do this in the best way possible. So with that, teaching how to feel each muscle. So if you can picture, as we usually use only one finger, so being able to feel the different muscles here, we're trained in how to feel for that. and making sure that patients are okay and comfortable with everything that we're testing, only testing what is needed. And we also, is the best way to get like a strength measurement, is going internally and seeing if patients can hold resistance to check the strength of those muscles. So that was a big emphasis of the level 1. We also did learn some techniques, so biofeedback, which there's different ways you can do that. We actually learned how to use like a probe where you insert it into the vagina, and it'll show like on a screen as you contract, how much contraction you're getting. And then when you're relaxing, are you relaxing right away? Is it taking a while? So that's a treatment option, or a way that we can help train coordination with pelvic floor contraction and relaxation. So that's something that I definitely feel comfortable with as I go into my clinical this summer. And then really, there's a lot to learn with the vaginal exam with all the muscles. We also do emphasize, checking breathing and posture, everything that you would learn in PT school aside from like the specialty. And then with the lab, we had some practice time so that we would really feel comfortable working with the patient, explaining things, as well as being able to identify, find this muscle, perform this technique on the patient. So you kind of have a partner through these labs. So yes, you get really close with them in that way, but I think it's definitely something that, you go into being really nervous, but everyone is there just to learn. It's not as scary, and you're doing it so that you know what it feels like as a patient, as well as having a patient. So after that first day, I was like, okay, if I can survive this far and be okay, like my level 2 will be just fine. So that is kind of the summary of level 1, and then I'll talk about a little bit what went into the bowel portion in level 2. And that itself had 2 different parts, so 4 days of webinars even before we went into the lab. So it was bowel, but also pelvic pain. Going into day 2, I definitely felt much more confident and comfortable because, you have to progress from level 1. Not everyone does it back to back. So I knew going into it, there would be a lot of people who have already seen patients, but no one had treated bowel yet. So it was still like new for everyone. And I think that, like I mentioned, like having that environment where everyone is, there to learn and be open is super important. And I think that the APTA did a great job with putting it together and getting through so much information in a way that was easy to grasp, and like you'd feel confident being able to perform it on someone because you had so much practice in that day. So the first part of day 2, we did bowel. Sorry, this is probably reverse for you, but we did bowel dysfunction. And not to be weird or gross, but the instructors were funny, and they're like, we're gonna do all of this before lunch so you don't have to freak out, because a big portion of this is how to perform a rectal exam. And when you're in these labs, you're the patient as well, so you're gonna get a rectal exam, you're going to perform one. So that was actually really nice, where we didn't have to like freak out about like, oh my gosh, like what if I feel like I have to go to the bathroom during this? So it was really nice that we just kind of got that portion out of the way. So the first part is a proctored rectal exam. So what that means is we're going step by step on how to do it as the instructors walk us through it. So in these labs, just for those of you who are considering doing a lab or going into a pelvic floor PT, you have to be willing to, like I said, be the patient. So you have like your patient on the table draped properly, and then you're performing the exam, instructions given step by step. I will say, if you have a health condition or are unable to be a patient, you can bring someone as your medical model. Which portion was just how to teach your patient breathing and have them relax or contract, to make that part the most comfortable. So that was a huge takeaway, as well as you can do, muscle testing in the rectum. For males, like everyone has a pelvic floor, but for males, or those who identify and don't have a vaginal opening, that's the way that you would be able to perform internal technique. So it's important not only for those who don't have a vagina, but sometimes there are conditions like if you have an infection where you can't go vaginally, and if internal exam is warranted for that day, it gives you that second way to assess the pelvic floor muscles. So with that, it's similar to the vaginal exam, walking us through what structures you're palpating, how to test coordination, and they kind of incorporated that into how to use digital feedback, so your finger to assist in proper pelvic floor contraction. And we also talked a little bit about how you could use biofeedback using that probe rectally as well, but we mostly focused on the digital aspect. So pretty much the whole first part of the lab was getting walkthrough of that, and then as we had time to review skills and all of that, they just walked around and kind of tested us as we were already in that area, if you will. And then we had lunch, wonderful, And then the second part of the day, we talked a little bit about techniques for like balloons in the rectum, but we didn't perform that. I actually have my own balloon to either try myself or just watch a video to make sure I would feel comfortable explaining to a patient. But the second portion of the lab is actually focused more on pelvic pain. So at this point, everyone that had gone through the labs have already known how to do the vaginal exam, so it wasn't necessarily walking through that again. That's expected. So we talked a little bit about testing for certain dysfunction, so Vulvodynia, which is pain around the vulva. So with that, I always forget I have this. The vulva is going to be this area. So there's actually a cotton swab test to test for any pain. And that was what we were ended up being graded on, everyone, to make sure we knew that. But we also learned more techniques like myofascial techniques that can be used internally to help when there is significant muscle tightness, tone, trigger points, all of that. But we also did learn a lot of external techniques, which was great because, on the first visit, you may not even be thinking about an internal exam. So it gives the option to provide treatment externally to some of the muscles. So there's certain areas around, like the glute area, that you can go in for levator ani here. So kind of pressing through from the external to do some work, and then working more like on glute release, because everything is attached at the pelvis and can contribute to pelvic floor dysfunction. We went through some colon massage, so helping with constipation, respiratory release, skin rolling, so a lot of those external techniques, which was super helpful. We also learned coccyx manipulation, which is this little guy, our tailbone, if you will. So we learned how to do that both internally and externally. But pretty much the 2 days was all like hands-on, feeling comfortable doing a vaginal and rectal exam, as well as treatment that may involve going internally or observing externally. So I feel, much more confident going into my clinical on what to expect, feeling comfortable that I could work with patients. So it was, not everyone would probably be like, oh, that was super exciting and fun, but it's very exciting to know, like, be closer to my end goal. So it's definitely something it's normal to be nervous about if you're someone that's going to attend, even for if you're someone that will have or wants to have the internal exams. It's nothing like, like a gyno exam, anything like that. It's much more relaxed. It's usually one finger flat, 2 at max, so nothing to worry about, and just know that you are always in control, and your PT is only ever going to do anything that would be beneficial and that you feel 100% okay with. So that was my experience with the labs. It was wonderful. I did mine in Milwaukee because I'm in Michigan, so yeah, the drive was like 5 to 6 hours, but I was able to do the labs back to back. Next up, I have men's pelvic floor webinar, which will be my last of the series. So I will continue to introduce, the topics I learned both in the webinars and labs, kind of area by area. Not like this is more of a general video, but I hope that this was helpful. So the APTA, Academy of Pelvic Health, has these where you can become CAP certified, and then Herman Wallace is also an option if you want to become a pelvic floor physical therapist. So I will keep you updated on my journey toward my clinical and practice. Thanks for joining. Make sure to subscribe below. I am so excited to be building this lovely community, and I hope you have a great day, and I'll talk to you soon.